Trigeminal neuralgia is one of the most painful conditions known to exist. It results in face, mouth, sinus, and head pain that is unrelenting. Usually this is on one side of the head, which to me is a significant clue that I should be able to help it. Why? Because unilateral symptoms suggest the patient's pain is not a systemic problem, and by that I mean a nervous system disorder, blood-based disorder, or disease. Instead, it points to a potential mechanical issue causing pain. And that's exactly what I found with the few patients I've had the pleasure of working with suffering from this very painful condition. You might be thinking, but this is a cranial nerve. How can we do anything about something located within the skull? Good point. But this is where a deeper knowledge of anatomy comes in, together with looking at the body as a system. The trigeminal nerve, which is cranial nerve 5, has an interesting anatomical feature in that its nucleus extends all the way down to the upper cervical levels C2 or 3. This particular nucleus, subnucleus caudalis, is responsible for pain and temperature sensory information. Because this is located at the level of the cervical spine, we as healthcare practitioners have a potential means to affect it. Looking at this from a systems approach, what else interacts with C1, 2, or 3 that could influence these levels? It would have to be something that can exert significant tension or torque on these levels, and it would need to be able to do so unilaterally. After combing through all the possibilities, I believe it is the levator scapula that influences this subnucleus caudalis indirectly through all the fascial tissues that send their fingers into the spinal column. How can we solve the levator scapula's pull on the cervical spine? By solving the reason it is under tension, fixing the shoulder girdle system. This is how I believe I've had success with the very few patients I've been able to see with this condition. Trigeminal neuralgia beautifully encapsulates what I mean by a systems solution. Using this method to solve pain, you not only must understand anatomy, but the implications of that anatomy on a system. Fortunately, I've made it easy for you to learn. I encourage you to join my online training program to teach you this way of looking at the body to solve pain. It's quite effective and produces rapid results. Unlike other training courses, you will have ongoing support from me as you implement this information. My goal is for you to become an exceptional health or wellness practitioner who is sought out because of your results. I hope to see you there. You can get there by clicking on the link above or below this video to healpatientsfaster.com.